Okay, today we're going to talk about quantitative research designs, and this information goes along with what you read in Chapter 9 in your group. This won't cover everything that's in Chapter 9, but it will give you a nice overview of some of the main points of the text and some of the items that are more difficult for students to understand. So in this presentation, we're going to look at key features of quantitative research design. We're going to differentiate between experimental, quasi-experimental, and non-experimental designs. We're going to talk about confounding variables. We're going to look at cross-sectional versus longitudinal data collection and studies. And we're going to talk some about the validity of research designs. Okay, in your textbooks, there's a table that talks about some of the key questions that you have whenever you're looking at a quantitative research study. And the first question that is asked is there an intervention? Are we going to do something? Are we going to manipulate some variable, or are we going to perform some type of activity that will have an effect on something else? So what will we be doing? Will we be introducing an intervention? And then in addition to that, we're going to talk about specific designs that we will use. How carefully will the conditions in this experiment be controlled to test whatever intervention we have chosen? And we're going to spend some time on a little bit talking about three main types of research designs: experimental, quasi-experimental, and non-experimental, that are going to make you better understand and be able to answer this question. Some other questions that we ask when we look at quantitative research design is, will comparisons be made? And what types of comparisons will be made? And really that's looking at the subjects in the study. Are we looking at the same people, which is a within subjects design under different conditions? For example, will we look at a group of women and see what their heart rates are at the beginning of the day, and then look at the same group of women and see what their heart rates are at the end of the day? Or are we going to look at two different groups of people, men and women? For example, we could look at men's heart rates first thing in the morning versus women's heart rates first in the morning. So between subjects is two different groups. Within subjects is looking at the same group, just at maybe different points in time or under different conditions. So the next thing we're going to talk about is confounding variable. And confounding variable, the first thing you have to understand is what exactly is a confounding variable. And it is just a third or additional variable that could explain an outcome. So let's talk about an example here. Say we want to see how caffeine affects heart rate. Caffeine is our independent variable. It's what we're manipulating. And heart rate is our dependent variable. It's what we're testing, it's the outcome that we're testing. So say that we gave someone a cup of coffee in the morning, and then we check their heart rate to see if there was if it was elevated from the caffeine, or if there was any change in it at all from the caffeine. A confounding variable would be a third or additional variable that could contribute to the change in the dependent variable. Say that before the subject drank their cup of coffee, they also took a brisk walk outside, which could also be attributed to the change in heart rate. So whenever we talk about controlling for confounding variables, what we are talking about is any third or any additional variable that might influence the outcome. And how are we going to make sure that there's not an additional variable in there other than the one we are interested in testing? Okay, the next feature that we're going to talk about is blinding. And this is basically withholding information from someone in the study to avert bias. So let's go back to our example of caffeine and heart rate. Say that we have two groups of people, and we're looking at how caffeine affects heart rate. And so that we check their heart rates, and then we give them all a cup of coffee. We have 10 people, we give all 10 people a cup of coffee. And then we check their heart rates again afterwards. Say 5 of the people are given decaffeinated coffee, and the other 5 are given Starbucks coffee, which has a lot of caffeine in it. But we don't tell them who's getting the caffeine and who is not. And that is so that they aren't having any control over their heart rate. Now that may not be the best example, but you're not telling them if they're getting a medication or an intervention or not. And we'll talk more about blinding here in a little bit. Time frames is another design feature that you'll see in your studies. They'll talk about how they collected data, and you'll often see the terms cross-sectional and longitudinal used. Cross-sectional means that all of the data is collected at one time. So say we do a survey, and we distribute the surveys all at the same time, and we get them back. That's a cross-sectional study. Now, longitudinal would mean that we are spreading our data collection out. So say we do a survey today, whenever you're first starting out in this course, then we give you the same survey in a couple months when you're halfway through the course, and then we give you the same survey at the end of the course. And that's considered a longitudinal design. You're collecting data at multiple points in time. Relative timing, this is retrospective or prospective. It's when are you looking at data, and retrospective, as far as relative timing, means looking backwards. Say at the end of the program, I give you a survey. At the end of this course, I give you a survey that asks you to talk about certain elements of the course, and you have to think back to those things and rate them, things that have already happened. That would be a retrospective study. A prospective study would be looking forward. So I might give you some questions about the course now, some questions in a couple months, and just keep collecting data along the way as you go, rather than waiting until you're done and asking you to reflect on that and think back. Location is simply where a study takes place, and you might see in your studies listed that studies can take place either at a single site, say one medical institution or one particular community, or they can take place in multi-sites in several different hospitals or in several different communities. And typically a study is considered stronger if it's a multi-site study, if we look at information over a broader area than just one specific area. Okay, now let's switch gears a little bit, and we're going to talk about causality, and this is really related to cause and effect in research studies. And in true experimental studies, what we're looking for is to see if our independent variable has some kind of effect on our outcome. Is it doing something? Is manipulating a variable, is introducing an intervention affecting the outcome? Okay, some terms that you're going to see in your text. Counterfactual. This is if we do nothing. If we have two groups of people, or if we have one group of people, would they have the same outcome regardless if they receive the intervention or not? So let's see an example of this. You have 100 people, and we look at those 100 people, and we see that this may be a poor example. We have 100 people, and they watch a news broadcast, and then we take their opinions on politics after they watch the news broadcast. Now we need to ask ourselves, would their opinions change if they didn't see that newscast? So did the newscast really cause the outcome? Was it really related to the outcome? Or did those 100 people believe what they believed regardless of what they saw on the news? So if we're looking at an experiment and we want to see that there's a cause-effect relationship, that your intervention leads to a particular outcome, or that manipulating one variable causes a difference in another variable, the independent variable, changing it affects the dependent variable, then there's a few criteria that we have to look for. The first of these is the cause must precede the effect. That means that the cause or the independent variable or the intervention, whatever it is that we're manipulating, happens before the outcome. So we can't say that we can't introduce the outcome after. We can't introduce the intervention after the outcomes happen and then say that it causes it. There must be a demonstrated association between the cause and effect. And basically we do this through statistical measures and statistical tests, and we'll talk about those later on in this course. And we also remember we have to control for confounding variables. The effect cannot be explained by a third variable or something else that's going on. Some additional criteria for causality or cause-effect. Biologic plausibility. That means there has to be some kind of cellular or biologic study or some basic physiologic explanation that's logical and relevant that would uphold what we're saying. Okay, when you read your studies, there are many different designs out there, and what you learn along the way, if you go on to your master's program or a doctoral program, what you're going to hear more and more is that your research question guides your study. Whatever question you come up with, that's what guides the design that you pick. So there's many different designs out there, and you don't just pick one randomly because it's the easiest or because it's what you're most familiar with. You look at the question that you're asking, and then you determine which design is the best fit to answer your research question. So the top kind of gold standard research design, the one that we say truly shows cause and effect, is called an experimental design. And in your research studies, you might also see these referred to as randomized controlled trials or randomized controlled clinical trials. And they typically yield the highest level of evidence because we control for a lot of confounding variables in these. We have very tight, we control the experiment very closely so that those confounding variables, those additional things that could result in an effect, are kind of taken care of, and we know that they're not going to interfere. So when you look in your text and you see the little pyramid that says these are the evidence hierarchies, that's why that one is at the top, because they say that it's the best at showing cause and effect because it is so rigorously controlled. In an experimental design, there is an intervention. The researcher manipulates a variable in some way. They introduce an intervention, they introduce a treatment in hopes that it is going to have some effect on the outcome. Also, the researcher places controls on the experiment. They use a control group. We'll talk more about control groups here in a minute. They think about who they're going to include in their study. They think about the conditions that their study is done in so that interfering variables or confounding variables aren't introduced, and to show that the intervention actually does lead to the outcome and that there are no counterfactuals in place. In a true experimental study, the participants are randomly assigned. What that means is if you have 100 people that you've picked to be in your study, then you just randomly 1, 2, 1, 2, 1, 2 put them into either the experimental group or the control group. That you don't say, well, if all people with blonde hair go into the control group and everybody with brown hair goes into the experimental group. In true randomization, it's like a lottery. You just draw a number, and whatever number you draw is the group that you go into, experimental or control. The purpose of this is to take away any researcher bias, to take away any other factors that might interfere with looking at the cause and effect of this intervention that we're wanting to test. Okay, there are several types of experimental designs that you will see used. There is a post-test only or after only design. And you see down there the symbolic representation RXO or nothing O. Okay, so in this you have your control group and your intervention group. Your intervention group would be your first group. So your first group of people who were selected and then randomly assigned into this intervention group receive the intervention. And then after they receive the intervention, you do some type of assessment of whatever outcome you're looking at. The second group is the control group, who is also randomly assigned. That's what the R stands for. They don't receive the intervention, and then you measure the outcomes. And you look to see if there's a difference between the two groups, the ones who got the intervention and the ones who did not get the intervention. Pre-test, post-test. This one is probably considered a little tighter type of research design because in addition to measuring the outcomes after the patient or the group receives the intervention, you get baseline data. So say we're looking at, let's do our caffeine example again. We have two groups, one control group and one intervention group. Both groups, people in both groups randomly assigned to a group in that lottery fashion. In the first group, you measure their heart rate, and then you give them their cup of coffee, and then you measure their heart rate again. In the second group, you measure their heart rate, you do nothing, and then you measure their heart rate again. So you have some before and after data to compare. And typically what we look at in the pre-test, post-test design is the differences that you see in the before and after in the groups. Okay, a crossover design. This one is considered one of the highest levels of research. You have two groups, okay, and they serve as their own control. Well, you have two groups that serve as their own control, and group 1 and group 2. But how they get or do not get an intervention is different. So in the first group, you give the intervention, or you do a baseline data, you give the intervention data again, and then maybe you withhold the intervention and gather data again. And then in the second group, you gather data, don't give an intervention, gather data again, give the intervention, and then gather data. So what you're doing there is you're switching the timing of when the intervention is given and when data is collected. So you can look to see if you switch the intervention up time-wise, if you're still seeing a change because of that. Okay, the experimental condition or the intervention must be designed with sufficient intensity and duration that effects might be reasonably be expected. And we talked a little bit about that with that biological testing. This is intervention fidelity, known as intervention fidelity. That means that whether the treatment was planned, was actually delivered and received. So if you plan an intervention, did that intervention actually, as you planned it, did your subjects receive it? And there's a lot of ways that we can do that. Many research studies, if they're doing an intervention, you will see the investigator, the author, explicitly describe how they gave the intervention, what the intervention consisted of, how the investigators were trained in conducting the intervention or the experiment, so that you know that it was given as it was described. Now, we said that we had a control group and an experimental group. The control group, you need to understand that control does not get an intervention. They get no treatment at all, or you might see that they get standard care. Say the investigator is wanting to test out a new intervention in comparison with an old intervention, or what we typically do now, to see if there's any difference in its therapeuticness. So you might see usual care as the control group condition. Or you might see them compare two different interventions, an alternative intervention. They might compare caffeine and green tea on heart rate to see if it stimulates it. Or you may see the placebo, like we talked about, caffeinated coffee versus decaffeinated coffee. Or you might see the same treatment modified and delivered. Okay, some other control group, attention control. This was seen in a study that I saw. There's a therapy called Reiki therapy, where it's kind of like therapeutic touch. And they trained two groups of nurses, or they had two groups of patients. And one group received this Reiki therapy from the nurses, and one group did not receive Reiki therapy, but also got some one-on-one time with the nurses. And the outcomes of those studies were that there was no difference between the Reiki therapy and the control group, the intervention and control group. But it was the attention that they received from the nurse that led to better outcomes. The other control group is a delayed treatment, where they may get the intervention, but it's at a different time period. And you could see that down there with the attention control and the delayed treatment. You see that the first group, the intervention group, gets the treatment first, and the control group gets it later on in the process. Okay, some advantages and disadvantages of true experiments, these that are controlled and have randomization. They are very powerful in showing cause and effect. However, they can be very difficult. It's very difficult to control for every confounding variable that may be out there. Sometimes it's unethical if you know that a treatment is good and you turn people away just so that they can be in the control group so that you can have a really strong study. Then that is considered unethical. And you can't do that in research. The Hawthorne effect, sometimes just people knowing that they're in a study causes a change in the results or a change in the outcome. And a lot of times, truly controlled, randomized clinical trials can be very expensive, and not all researchers have the resources to be able to conduct these. Okay, quasi-experiments are, they are experiments, but they lack either randomization or they lack a control group. And there's a couple of different types of quasi-experimental designs, non-equivalent and within subjects designs. In non-equivalent control group designs, those getting the intervention are compared with a non-randomized comparison group. So we have two groups that are getting an intervention, but people may have not been randomly assigned to those groups. Or within subjects design, and that's kind of like our pre-test, post-test. We look at the same group, do an intervention, and then look at them again to see if it's changed anything within them. Okay, so non-equivalent control group designs. Pre-test, post-test, we have two groups. One group gets the intervention, the second group does not get the intervention, and we collect data at 2 points before and after the intervention for the first group, and the second group we just collect the intervention at 2 points in time, and we compare the differences. Post-test only is a much weaker design, so if you see that in your studies, just know that it is weaker than the pre-test, post-test. We still have two groups, but all we're doing is looking at the data after we have conducted the intervention. One group pre-test, post-test design. Again, this is a weak in terms of cause-effect, but can yield some useful information. And a lot of times you'll see this this type of design may be used in like continue quality improvement projects. So we look at a group, just one group, we do the intervention, and then we collect the same data again to see if there's a change. And the time series design, it's a little bit stronger than the one group pre-test, post-test design. It's similar though, except you collect data at multiple points. So we spend 4 weeks collecting data 4 different times. We do our intervention, and then we collect the data on those people again 4 times. So what are some advantages and disadvantages of quasi-experiments? They are easier and more practical than true experiments, especially for researchers who don't have a lot of resources. But you can't infer cause-effect, and there may be rival hypotheses for results. Okay, the third major type of experimental design is non-experimental studies. And this is basically, they're not controlling any type of independent variable, they're just gathering data to find out more about a subject area. Some types of non-experimental studies that you will see, correlational designs are fairly popular. And a lot of times correlational designs are done by novice researchers or people that are just getting started in a research topic area. So what they're looking for is to see if there are relationships between 2 or more variables. In a prospective correlational design, there is a potential cause present, and it's hypothesized to a later outcome. These are called cohort studies. That means we collect the data. We say, okay, I want anybody who smokes, if you're a smoker. And then 6 months later, we'll look to see health effects like cardiovascular or cancer or depression, whatever, to see if there's any type of relationship between those two things. Retrospective, like we said, is looking backwards. So we might look at all the people who have lung cancer and then go backwards to see if they were smokers and see if there's any type of relationship there. Descriptive research are things like percentages, how many people have a certain disease within a population. Or descriptive correlational is to describe the relationship between two variables. There is a strong positive relationship between smoking and lung cancer. We can't say that smoking causes lung cancer, but we can say that there is a strong link there. Non-experimental research, it's fairly easy to do, especially if you have some nice databases or you have some nice information to use, but you cannot draw cause-effect inferences from non-experimental research designs. Okay, some other things you need to be aware of when you're looking at your studies, and we have already discussed these. When data is collected, cross-sectional is at one time, and longitudinal is over 2 or more points in time. And a problem with longitudinal study is typically you're collecting data from the same people over a time period, and sometimes you might lose track of those people, so you can't get the follow-up data like you need to. Controlling the study context, constancy of conditions, control over environment, setting, and time, control over an intervention via a formal protocol. Remember, the more detail that is in the research design, the better, and the more that the researcher has tried to control for confounding variables, the stronger the research study is. Controlling for participant factors, we talked a little bit about randomization, homogeneity, matching. Randomization is when you have 100 people that meet a certain criteria. Say you're interested in looking at depression in American women in their 40s. So you would want to limit people in your study to women. Of course, you don't want men in your study between the ages of 40 and 49 who live somewhere in the United States. And then however many people you recruit, you would just, through the lottery system, assign them to different groups. Matching is done whenever, say you have one woman and she's 48 and she has 4 children and she lives in southern West Virginia, then in your control group you would find another 48-year-old woman with 4 children who live in West Virginia. There are also statistical measures that can be used to control for participant factors. Okay, let's talk about validity in research. Validity refers to the truthfulness of the research findings. The truthfulness can be somewhat determined by design, so we need to look at those things when we're talking about research studies, because you want research studies that provide true findings. So the types of validity that you're looking for are statistical conclusion validity, internal validity, external validity, and construct validity. Okay, in conclusion validity, specifically how it was done, who was trained to do it, you're looking at statistical powers, and based on how many people were in the study, was your statistical measures accurate? And one of the best ways to protect against this is to have a large number of people in the study. And a lot of the studies that you all look at might be pilot studies or smaller studies, so you need to take that into consideration. Internal validity,